A lot of times these patients are taking their medications and we think that they're doing well, and only to find out the blood pressure not going down. When you check the bottle for the medication, it expires. And if medication is expired, there's no way for us to actually control patients' blood pressure, control patients' diabetes, without having the proper, checks done. Hi everyone, welcome to the channel. Thank you so much for tuning in. All right, so today I am on the road. It is Wednesday. It is Wednesday the 8th, and I'm doing some house call visits. Outside is very cold right now, so I have to double up on this jacket. Usually I'll wear this jacket by itself sometimes when it's cold, but I put on this fleece under because the temperature outside is 34 degrees. The other jacket I had on, it's too cold, it's too hot. It is too hot. Yeah man, it's too thick. Earlier in the week I needed it because some days it felt more like 5 degrees, so I needed it at that time. But today I don't need it, so I'm doubling up on these because I think later on in the day I'll be able to take off one. But nevertheless, work has to continue. Since this week started, I feel like I wanted to just stay indoors and do like all virtual visits. Yeah, but I'm not gonna do that unless it's very icy. Then probably I'll do something like that. But I've seen 2 patients so far for follow-up. There's a stroke patient that I saw, and with her, she is doing good. Physiotherapy is doing wonders for her, and her family support is very good. All right, so when I am seeing patients during the week, I see patients with different concerns. I'm putting on some lip gloss here because I see a mixture of patients during the week for follow-up, and for the hospital follow-ups, it's usually, the patient has been to the hospital, they're discharged, and so we have to go ahead and do their evaluations post-discharge. All right, so I just saw a patient, and I'm gonna be heading over to another group home. And this patient today, she has multiple requests, that we've placed a few times, but only a handful of them got, approval. So, she's upset, but I really can't help with that sometimes, because if insurance doesn't approve it, I don't know what else to do. Even when you do try alternate medications, then sometimes they don't approve them. But anyways, all right, so one thing that I definitely want to encourage a lot of us to do is those medication reconciliations, because sometimes when we're going to see patients, the patients, they do have a lot of medications, and I tell you, the medication list goes along from here to Timbuktu. It's a lot of medications they have. And when they're discharged from the hospitals, they also get additional medications being discharged with, or they are, some of the medications are discontinued, and some of the medications that they originally had are discontinued, or they have newer medications that they will have to start. And so when I go in and see them, I try to get a very thorough medication reconciliation done at that time, because when I do medication reconciliation on the first time that I see the patients, or at like any visit that they had where they probably had some changes to their medications, I normally go through again and do a very detailed medication reconciliation, just so that we're not missing anything and patients are not taking something that they're not supposed to be taking. And so, one thing I want to encourage us is to make sure we're doing that, because some of these patients, especially when you're meeting them for the first time, you'll realize some of these patients are taking medications from 2017 and it is 2024, and you're wondering, is that medication still even good. So the patients will tell you that yes, it's still good, you know. And it's not like they're not getting medications, you know. It's not like them short on medications. Medications are coming out like every month or every 3 months for these patients, but they feel they don't want to give up the expired medication. One nitroglycerin, I saw this patient with a nitroglycerin, and she has been taking nitroglycerin for 7 years, you know, as needed. And I'm like, okay then, at what point do we throw this away? I couldn't even tell it was nitroglycerin. The only reason I know it was nitroglycerin is because the bottle brown. You understand that little bottle that nitroglycerin come in? If you're familiar with the bottle, then you'll definitely know it's nitroglycerin. So we need to just try to encourage, you know, home health services or us as nurse practitioners when we're going to see those patients, just to make sure that we're checking these bottles and making sure that the patient's medications are good. Because a lot of times these patients are taking their medications and we think that they're doing well, and only to find out the blood pressure not going down. When you check the bottle for the medication, it expires. And if medication is expired, there's no way for us to actually control patients' blood pressure, control patients' diabetes, you know, without having the proper, you know, checks done. And so that is one thing I definitely go through and do thoroughly with my patients, you know, because at the end of the day, some of these patients are depending solely on these medications to help with their health. You understand? So if we don't take the necessary step and get those, you know, fixed, you know, get the medications up to date, then the patient is just going to be there in the same position as if, you know, they're not being seen or being treated by a professional. All right. So we definitely need to make sure that we're focusing on their medication reconciliation. Still go ahead and request their medical records, because that is, you know, like, it's a lot of information you'll get from it, especially when they're admitted. You know, you get their lab work, you get their radiological studies, you know, you get everything from the referrals to, you know, whatever the plan of care is. You definitely get everything. And so that is one thing that I enjoy, you know, reading through, because you get a better picture, a better idea of what the cardiologist is saying, what the nephrologist is saying, you know, the pulmonologist, and everybody that is a part of the team. So I definitely go ahead and get those notes. Yes, it's going to be a very lengthy note, but at the end of the day, you know, at least it's a part of your record. You can always have it to go back on. And with the labs that they did, you know, I always use those as a part of my, you know, plan of care. So for example, I have a patient that needs to do a lipid panel. If they just had one done in the hospital, I just go ahead and get one. I just go ahead and use that same result. I don't get another one. If they had their A1C done, I go ahead and time their A1C from that date and then do the next one 3 months time. So that way, you know, we're not doing too much testing for these patients, because over time it becomes annoying, bothersome. It is something that patients don't like. You know, I don't like getting IV sticks every 5 minutes or every 10 minutes. So I don't think anybody would want that. So definitely go ahead and use their results just to help with guiding my plan of care in the practice here. And as I say, you get a lot of information regarding like the recommendations, you know, who they need to follow up with, the new medications, what they discontinue, what they want to continue. And from there, you're able to, you know, just continue with the care that the patient needs. And that's it for the post-hospital visit, to be exact. If they have surgeries or anything, and you know, you definitely need to get like wound care or wound services for them, you do the referrals to the specialist, you know. And sometimes these patients are also referred from the hospital setting. So it's just our responsibility to go ahead and try to get those referrals being sorted out for those patients. Try to call in and make sure that they do get it, because sometimes they might put on the paper in the emergency room that the patient is referred to this facility just out of mere, you know, the fact that you're there. They want you to actually follow up with a specialist, you know, but they never necessarily call the office and say, hey, we're sending over Stacy to get you evaluate them, you know. So it's just our responsibility to just make that call for the patient or fax over the request to them so they can actually continue with the plan of care for these patients that we're attending to. And you know, just to make it a little bit more, you know, easier for these patients that we're seeing. All right, so I'm gonna go in and see another patient. This is a group home, so I have 3 patients there. Most of them are like psych patients, so I will definitely see them. They're being managed by psych as well, so the psych team will go ahead and put in their medications, and I will just get anything that is acute for them. For these patients, we do their blood, we do urine tests very frequently for them, especially because they're on some controlled substance. So we definitely go ahead and do urine drug screen for most of them, and then from there we order certain medications. All right, otherwise I will tell you a little bit more when I am done. So it is after 12. I have 2 more homes to visit, and then I will be done for the day. Yeah, so that's the thing about, you know, house call. You can have the flexibility that you want. Okay, so but nevertheless, I'm gonna have patients charts to do. So I'm gonna see another set of patient at this group home, but I tell you, I don't know, but some of these patients not taking care of themselves. Every day I go, it's more of, or every time I visit, it's more of, you know, they can't find the medications. They can't find the food to take the medications. And I don't know what else to do with these patients. Like, I don't know what to do with these patients. Alright, let me go in and see if they're there. If not, then I'll just continue driving. The only reason I came over here was because they are 2 minutes away from the other house. So I just decided to stop by. Because their phones don't work. Don't work any at all. Alright, so let me go in and see what's happening.